Providence Regional Medical Center Everett is the largest hospital north of King County. It is the second largest hospital by discharge in the state. We provide all levels of care and receive many patients from the 5-county area. Our emergency department sees close to 100,000 patients a year, which puts us typically right at the top. We're the 9th or 10th largest single site emergency department in the country. So our community relies on us to be the safety net. And we want to be there for our community. We want our community to be able to receive their care close to home.
Providence Hospital is one of a few hospitals that are designated as a level 2 center in the state. My vision for Providence's future growth as a trauma center would be to be a level 1. The reason I say that is our community is growing. The volume that we're seeing just necessitates a higher level of care. We need to be at the forefront of trauma for the state and for the region. And we have that resource here. We just need to get the word out, make sure our community understands what we have to offer.
Describing electrophysiology, it's we're the cardiologists who focus on the electrical system of the heart. We're really the electricians for the heart. One of the biggest procedures that we as electrophysiologists do is something called an ablation. And the goal of an ablation is to identify and treat sources of abnormal heart rhythms. Some of the ways in which we've really excelled are minimizing the use of fluoroscopy or radiation, and so we've been able to do most of our procedures without the use of any radiation whatsoever.
My primary training is in cardiology and interventional cardiology. So interventional cardiologists, they open up heart arteries that are blocked, and opening these arteries with balloons and putting stents in is my primary job. I'm sort of a plumber. I get the blood back. We do TAVRs, which is transcatheter aortic valve replacement. The whole aortic valve is replaced with a catheter. That's a big advancement.
One of the things that we've always been good at, not only have we always looked towards quality, we also paid attention to the costs. And what I've been proud of over the years is the fact that we've been able to do that, and we've consistently over the years have been ranked as high achieving at a low cost. And I want to maintain that and improve that. There's always room for improvement, both on the quality end and at the cost end. I think I'm not stating it too loudly by saying this is a community asset that we want to grow.
In the 10 years since the Cancer Partnership opened, we've had about a doubling of the number of providers in cancer treatment that we've had in the Cancer Partnership. The number of patients that we've seen have similarly grown as well. So there has been great progress in terms of cancer care and the effectiveness of cancer care. And I find it very exciting that new treatments continue to develop, not just in cancer drug treatment, as in chemotherapy, immunotherapy, and targeted genomic therapy, but also in terms of newer types of radiation treatments, newer types of surgical procedures that are available for cancer.
The reason I went into neurosurgery was because I thought it was the hardest thing that you could do. I figured that if I could do neurosurgery, I could probably do anything within the medical field. We do about 110 surgeries a month that span the gamut from degenerative spine disease to brain tumors and aneurysms. And I'm hoping that in the next year to two, we will start a movement disorders program where I would like to then expand into more things like Alzheimer's, which is affecting our patient population more and more as we age.
We're really excited about having the opportunity to work with neurology, cardiology, and trauma, for example. There are so many opportunities to conduct research in those areas. By having clinical research at Providence, it really provides a halo effect for the hospital. I've seen over my 20-year career a huge change in how we treat patients, and it's because of research that we do that.
These are the examples of the new and cutting-edge things that we do here in our community. That's the biggest change that I see. That's what excites me. That's exactly why I do what I do. I don't mind getting paged at 2 a.m. to come and treat a patient because that's what I live for. And that I live for one reason, to be here and care for the patients. And I love it.